Well, Nara, we are so excited to have you. And this being our first video, I would love to let the audience know more about you because there's going to be multiple other videos related to the topic of HIV that you are going to speak on, and we're all going to have conversations about. But let's get first things first. We want to know who you are as a human, a little bit about your background. So if you could just take it away and tell us what you want to tell us, that would be fantastic.
So, first of all, thank you guys so much for having me here and actually giving me the space to talk what I do and getting to know me and what I do for a living. It's definitely a passion of mine. So, my name is Nara Lee. I'm a proud clinical social worker. I work at in a hospital-based outpatient clinic. And so I am currently the social work manager, and I have a couple of social workers under me and some patient care navigators. I've been doing HIV for about going on 10 years now. And a lot of times people see me and they're like, 10 years, you don't look a day over 25, right? But it is the Asian genes that like helps me look very young. But I think the thing that like I really enjoy doing and I've been doing for a long time is doing the initial intakes. So I'm the gatekeeper for a clinic, and interact with parents and also young adults and teenagers that get newly diagnosed. And so, I'm meeting a lot of these patients at the worst time of their life, and being able to kind of calm them down and also reassure them that it is not over. Like when you get a lifelong diagnosis in any case, right? Any kind of diagnosis, but especially with HIV and with the stigma that it has, it's very devastating. And I do know that with my patients, I thought, oh, this is just like another normal. Another normal day for me. But I had a patient of mine after he transitioned over to adult care several years later. He actually ended up calling me saying, hey, like I just wanted to kind of catch up and let you know that I'm doing great. He was like 28 at the time, graduated from fashion school in New York, and he personally called me and he was like, I wanted to thank you. And I was like, thank me for what? And he said that he still remembers what I was wearing, what my hair looked like, what the room smelled like, who was in the room when we disclosed to him that he had HIV. And this was a patient of mine that was born with HIV. So we disclosed to him when he was about 13, 14. Yeah. And so that really kind of jarred me of like, wow, like I didn't really realize that I was having this kind of impact, and the fact that like, sometimes I can't even remember what I had for lunch yesterday, right? But the fact that I remembered after years, like he was one of my first patients when I was like 23, 24. And several years later, he called me and told me that, and I was like, wow, like, it gave me more of a motivation and a fire, within me to be like, you know what, like a lot of times, a lot of social workers in general, we don't get to see the fruits of our labor in a lot of ways, right? You see patients and then they end up leaving, or you only see them for a very brief moment of time. But the fact that like I've been doing this for a long time, you get to see the progression, right? And I feel like I'm so lucky to have had that, nuggets of like feedback of like, okay, I can do this even on the toughest days. So yeah, I love what I do. Our clinic sees kids from the ages of 0 to 24. And we not only see HIV positive patients, but we also test mothers. So these are HIV positive mothers that bring their infants in to get tested. And a majority of these mothers are on medications, they're undetectable, they're doing great, going to their prenatal appointments and, have a natural vaginal birth, and they're able to bring their children in and get tested. And I mean, in the last 10 years, we've only had like maybe a handful of positive babies out of thousands, right? So technology and medication has literally come a long way since the 80s. And then we also have a clinic. It's only been like a year and a half to 2 years. We have a PrEP clinic, and I'll probably talk about that later. And it's for HIV negative teenagers to come and want to prevent getting HIV. So that's me in a little nutshell.
That's amazing. And Dr. Sue wants to say something too. And so I won't cut her off, but
I just think it's amazing work. And I think that it's work that you do that kind of keeps us in people's minds. Because I think, and I'm sure we'll talk about this in a later video, this idea that like, it's not an issue anymore. So I just wanted to thank you for the work that you're doing.
And I do have to ask, because we did have some conversation before we started rolling this video, and Nara was telling us about her hashtag. It's not an official hashtag yet, and I feel like you just have to share it. The world needs to know what is happening in these Uber cars. And so yes, we're all very excited. And now I've like created that tension, so we can't resist but no now.
Okay. Wow, that's a lot of pressure, right?
Yes.
So one of the things that when I do a lot of presentations on Zoom or in person, I love having a fun fact about myself. And a fun fact about me is pre-pandemic and even post-pandemic, I do this thing where I love taking Uber rides, but not just regular Ubers. I like taking Uber pool. So that means that I get to meet people from all over. I live in the inside the District of Columbia. So, DC is really transient, people from all over the world, and I get picked up at the hospital. And so obviously they're going to be like, what department do you work in? And I'm like, wow, this is like, it's like serving it on the silver platter for me. And it's my in to educate people, right? About HIV, about the rates. And you'd be really surprised how many people really don't know that this is still a epidemic in the DMV area. So every time I get into the Uber, they ask me, I tell them I'm in pediatric and adolescent HIV, and they just start bombing me with like questions, right? And I've actually made friendships and made networkings. And so my whole hashtag or tagline is teaching HIV 101, one Uber ride at a time. And you know what? I would be totally up for Uber sponsoring me. if they want to sponsor me, I'm all for it.
Oh, Nara, that is so sweet that you would suspect that this little old YouTube channel, we can get on that platform. But Uber, we're coming after you. Nara is going to be your next your next spokesperson. I love it. Well, thank you so much. We are very excited to be able to learn more in future videos. So continue to check out Nara and the conversations we're going to be having soon.